Hello, 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 and welcome to Wellness Wednesday with Dr. Latoya Wells. We are here for another episode of Wellness Wednesday. I'm so grateful that you are here. I am Dr. Latoya Wells, doctor of nursing practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. Wanted to just come in today and continue our discussion on National Kidney Awareness Month. We've talked about several things related to the kidneys. We talked about the signs and symptoms. We talked about what the kidney is, things that we can do to protect our kidneys, some of the foods that we can eat that could cause some issues with our kidneys, medication, things of that nature. We're going to continue this discussion tonight on kidneys as we are in the month of March. And as we mentioned before, March, each month, not just March, has several different health conditions that are highlighted and that we focus on and that we bring awareness to and that we can choose to advocate for and to donate and give towards, and just make sure that we're providing education to our community in regards to these different health conditions. And so I chose this month because, one, I feel like this is something that's not talked about as much. And I have seen time and time again how kidney disease and kidney injury can impact the lives of people in the community and patients that I've seen and my family and friends. So wanted to just bring this topic to you all. I hope that you're getting something from it each and every Wednesday. In April, we'll have a different topic, and I'll let you all know about it soon. But tonight, we're just going to delve into it. So, just wanted to talk about the journey towards understanding and nurturing one of the most vital organs in our body, and it's our kidneys. We talk about when we talk about nurture and taking care of, many different things may come to mind. And for me, I find that it's important that we take care of these bodies that we have. We only have one. This is the only body that we get, and we are responsible for what we do, what we put in this body, and how we take care of it. And as I mentioned, March is National Kidney Month, and it's a time where, one, we raise awareness about kidney health. We talk about the different stages of kidney disease, and then some factors that could potentially damage these organs that are so valuable. The kidneys often refer to the body's filtration system. So they, as I mentioned early on, I believe in week one of our discussion on the kidneys are the filtration system. If you can think about in your home, many homes have a filtration system, a water filtration system. You can buy water bottles that have the little filtration system in the middle of them. You can buy water pitchers that have the filtration. I think when I think of filtration, I think about Brita, right? Many of us have heard of the Brita water filtration system, whether it be on the faucet in your home, whether it be the whole house filtration, or one of the bottles, or one of the pitchers that you use for juice and water and what have you. It filters the excess waste and toxins before it gets to you, and that's the job of a filter. And so the kidneys is essentially the body's filtration system. It is crucial in, one, maintaining overall health because it helps to get rid of the waste. It helps to get rid of excess fluids, any toxins that can get in the blood, and that, if not filtered, can build up to dangerous levels. It also helps to regulate the blood pressure, as we talked about in the past or the past few weeks. And then it produces essential hormones. It also helps you maintain electrolyte balance. So the kidneys are important. However, even with that being said, there are millions of people who are dealing with kidney disease, and from serious injuries, from comorbid condition or disease processes, and many other different factors can impact the health of the kidneys. And so we have two kidneys. And as I mentioned earlier, there are some people who have three. There are some people who have one kidney because they've chosen to donate, or they were born with just one kidney, or something happened and one had to be removed either due to damage, because of trauma, or it may have been due to cancer or some disease process that caused that individual to have their kidney surgically removed. We talked about several things as it relates to the kidneys, and I alluded to last week, I believe, chronic kidney disease. There's different stages of kidney disease, and we talked about the different labs last week that we should have ordered for us whenever we go to our healthcare providers, right, for our annual physical exams. One of the things is looking at the kidneys, and it looks at how well the kidneys is filtering, and that's called the glomerular filtration rate, or GFR. And so that can be tested by one, blood or urine sample. And so one or the other should be done, or both if possible, should be ordered by your healthcare provider. So when we go back to the kidney stages, and I think last week I talked about end-stage renal disease when we mentioned dialysis and chronic kidney disease. So today I want to delve a little bit more into the stages of kidney disease. And so you have 5 different stages, and depending on which literature or which resources you look, it may have them categorized a little differently. But we're going to talk about them in terms of stage 1, 2, 3, 4, and 5. Then we'll talk a little bit more about some of the things that we are doing, knowingly or unknowingly, that's damaging our kidneys. And what can we do to kind of try and rebound from that? So stage 1, kidney damage, is with normal or increased GFR, which is the glomerular filtration rate. So on that blood work, we see that it's normal or just slightly elevated. In this stage, which is the initial stage, the first stage, the kidney function may still be relatively normal. So your kidneys are functioning normal, but the test is showing evidence of some signs of kidney damage. There may be some protein in the urine, right? And so the reason why I stress those wellness exams and getting in for your physical exams and having the blood work done is because if we can catch this early, then we can potentially reverse it and figure out what the cause is. So checking things out early and managing what's going on at the earlier stages is helpful in one, to prevent it from progressing to the next stage. And with that being said, we have stage 2, where there is a mildly reduced GFR, or glomerular filtration rate. So as the number begins to decrease, then it's showing signs of greater kidney damage. So the kidneys are functioning, they've been impaired, there's some mild impairment there. We'll see a slight or a small decrease in the GFR. The symptoms may still not even be there, or they may be subtle. We may not even be able to pick up on them. But again, monitoring regularly and frequently is going to be the key, especially if we already see you had stage 1, the numbers continue to decrease. Now we have you at stage 2. We need to keep an eye on you. We need to figure out what's going on, review the blood work, making sure we're looking at things that could be potentially causing the kidney damage, process of elimination, medications, foods. Are you hydrating or not hydrating enough? Is there any underlying issues, diabetes, hypertension, that could be causing this damage to the kidneys? The next stage, of course, is stage 3. And that's where we have a moderate reduction in the GFR. And so at this point, the kidneys are compromised. Patients are experiencing fatigue. They're having some swelling in their legs, their hands, their feet. Some may even experience in their face. And then there's some changes in the urination pattern. So you're not urinating as frequently, or the color, there's a different look to the kidneys or the urination. And so again, early prevention and detection is key. The next one is stage 4 kidney disease, where the GFR is really, really severely impaired. It's at this point, it's reduced, and the symptoms are even more pronounced. And so there's a significant health risk that's going on. We, at this point, not that you don't need medical intervention in stage 1, 2, and 3. We can do things like lifestyle modification for stage 1. Stage 2, we're looking at things a little bit more closer. Stage 4, stage 3, we're really taking a look at things. We're monitoring there's some additional blood work and testing that may be done. We've probably gotten some images of the kidneys at this point, ultrasounds of the kidneys, MRI, CT, what have you, to just see what's going on. Looking at the blood vessels that are going to the kidneys, looking at the kidneys in themselves, making sure that there's no polyps, not polyps, but like tumors or anything like that that could cause the kidneys to be damaged. And so with stage 4, there's a significant decrease in the GFR. And this is where medical attention needs to be implemented. So things such as medication, we are also continuing with the lifestyle modifications. And it's imperative that we react and make sure that we provide care medically at stage 4, because what we're trying to do is prevent it from progressing to the next stage, which is stage 5. And so when we're looking at stage 5, this is the final stage of kidney disease. The kidneys are no longer functioning effectively. These individuals are on dialysis, and they either have had a transplant, kidney transplant, or they're waiting to be put on the list, or they're already on the list for kidney transplant. And so dialysis and kidney transplantation is a must for survival at this rate. And this one we call end-stage renal disease. And there's many different factors that go into calculating how someone gets placed on the transplant list. And hopefully next week I'll have my colleague and really good friend, sister friend here to talk to us a little bit more about the kidneys and when someone is at the point of end-stage renal disease and what they need to do, and just kind of shed a little bit more light on the kidneys and the damage that we may see from a clinical and medical standpoint. So what are some things that could cause kidney damage? We talked about something last week, which is acute kidney injury. And that can be to trauma to the body. That can be from a fall, and individuals have, remained on the ground for a prolonged period of time. And there's toxins that begin to build up in the body, and those toxins damage the kidneys. There could be, tumors, things of that nature that could cause dehydration, can cause acute kidney injury. And so many times we can reverse it by providing treatment. So if there's dehydration that's causing it, then we want to give that individual fluid. If it's some type of trauma, evaluating the kidney, the extent of the damage that was caused from the trauma, and figuring out what we need to do. Is the kidney still viable? Does the kidney need to be removed, and things of that nature? So there's a lot that goes into whenever there's kidney injury. What are some things that can cause damage to the kidneys, or can damage the kidneys in and of themselves? We talked about this a little bit last week and previous week. High blood pressure. So uncontrolled high blood pressure damages those blood vessels, as I mentioned, that go to the kidneys over time, leading to kidney disease. And so if you can remember, I talked about the kidneys, the blood vessels leading to the kidneys as the size of maybe this pin. And then you have the blood pressure that's causing increased pressure within this vessel, and they begin to become damaged. The image that I gave last week or the week before was, if you think about a water hose and there's a lot of pressure on that water hose, the lining of the water hose tends to become weak, and it can create an extra little bubble, and that bubble over time will burst, and you will damage that water hose, and it's no longer usable. And so if you think about a high level of pressure going through the blood vessels, which damage the small, tiny blood vessels that are leading to the kidneys, as well as some of the other blood vessels. Anytime you have high blood pressure, is exactly what it is. The pressure within the vessels is high, which gives us that increased reading. And so it's important to, one, monitor your blood pressure. If you've been told that you have hypertension or high blood pressure, don't take it lightly. Get treatment, seek out treatment, go to your healthcare provider. If they told you that you have high blood pressure, that individual told you that you have high blood pressure, hypertension, what are they doing about it? How often are we monitoring it? How often do I need to come in and be seen? Will I need to go on medication? And I know there's a lot of individuals who like to look at alternative methods to taking blood pressure medication. Diet and exercise can be great on monitoring the blood pressure. However, if the blood pressure is extremely high, I would say sustained 140 over 90s and above, then we really need to look at what's going on and potentially look at medication to help treat that. But a lot of times, if we have someone whose blood pressure is slightly elevating and we're noticing that it's slowly climbing over the years as we're monitoring their blood pressure, then we really can look at the amount of sodium and salt intake that this individual has, and decreasing that could cause the blood pressure to go down and kind of stay down. Another one is diabetes, which is the leading cause of kidney disease. Diabetes impacts the entire body. So blood sugar levels are consistently elevated and it damages the kidneys filtering system. Again, we talk about that blood vessel leading to the kidneys, and then you have that sugar molecule, which is this little thing or this rock. I like this rock. It says, "You got this," and focus on the back. So just a side note. So you have this blood vessel, and then you have this glucose molecule trying to force its way or fit in this small blood vessel, which is then causing damage to the kidneys. And so another thing is smoking. We talked about that. Smoking can cause kidney disease to be worse. It can interfere with medication that can be used to treat it. And it also increases the risk for developing kidney cancer. And so smoking, we've talked about that. I'm not going to get on my soapbox about smoking because I think we all know the implications of smoking and how it can harm us and how it can impact our overall health. Obesity. So being obese or having excess weight, it puts strain on the kidneys and it increases the risk for developing kidney disease as well as other complications such as diabetes and high blood pressure. Certain medications, we talked about this a little bit last week. So some over-the-counter medications, some prescription medications, when used excessively, we talk about the ibuprofen, the NSAIDs is what they're called, the Aleve, the ibuprofen, the Advils. Those things can cause excess strain on the kidneys, and excessive use or prolonged use can cause the kidneys to become damaged again, because think about it, the kidneys is filtering everything that comes through the body. Your kidneys is filtering out. And when we talk about the filtration system, we have the kidneys and then we have the liver, which is another discussion. But the kidneys filter pretty much everything that comes through our bodies. So we got to make sure that we are taking care of our bodies. And so going back to what I said initially is we have to nurture these kidneys that we have. We have to take care of them. We have to be mindful of what we put in our bodies and what we do to these bodies, because every little thing that we do affects an organ system within our, one of our organ systems, which could cause, some pretty bad things to happen. Unhealthy diets that are heavy on sodium, a lot of the processed foods, the sugary sodas, we talked about those, can contribute to high blood pressure, diabetes, and obesity, which puts you at a greater risk for developing kidney disease. And then again, we talked about genetics. So there's some individuals who are genetically predisposed to kidney disease, depending on what their family history is. And I'm not going to go into the genetics tonight, but I just wanted to highlight that because there are some individuals who, regardless of what they do, their genetics has put them at a higher risk for developing kidney disease. And so if they've developed kidney disease, it's not because of it's something that they've done in and of themselves. It's because their genetic makeup is one that puts them at a higher risk for developing kidney disease. So we have the 5 stages of kidney disease. We talked about some of the things that could cause damage to the kidneys. Next week, we're going to spend a little bit more time on, hopefully I'll have my friend here that she can speak a little bit to us, but we'll do some more digging on things that we can do to take care of our kidneys. So 1, make sure that you're prioritizing the health of your kidneys, getting those frequent checkups, maintain a healthy lifestyle, and make sure that you're paying attention to your body, because our bodies will tell us things. It'll warn us. It'll let us know when something's not right. And so with that, we need to make sure that we are paying attention to our bodies and we know what our normal is, or I would say we know what our baseline is. Because if you know what your baseline is, then you know when there's something that's off. And when something's off, it will cause you to take note of it. So I just want to say thank you all so much for being here tonight for another episode of Wellness Wednesday with Dr. Latoya Wells. Hopefully next week I'll have an announcement and we'll have our my friend here with us to discuss kidney health. She is one of the individuals that I consider to be a kidney expert. And so hopefully our schedules will synchronize and we can get her on here. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner and owner of Wells Legacy Health and Wellness. We are located at 452 Osceola Street, Suite 106 and 107 in Altamont Springs, Florida. Our number is 321-306-6755. You can catch us on Instagram, Facebook, TikTok, Twitter, YouTube, all the things. If you know somebody who needs medical care and they don't have a healthcare provider, send them our way. We are accepting new patients. We do have flexible appointment times, early morning, evening, weekend appointments, virtual visits, convenient care visits, where we provide care in an area that's convenient for you. We want to make sure that our family and our friends have what they need, the knowledge, the information that they need to be able to advocate for themselves and to leave a legacy of good health for generations to come. I truly believe that families who practice healthy lifestyles pass those traits and those habits on to the next generation. And what's more important or exciting to know that those that are coming behind you have information that you've been able to pass on to their mothers and their fathers by way of your children and your family members. So again, thank you all so much. We are accepting new patients. We currently accept Medicaid and Medicare and TRICARE. We're awaiting a credentialing approval from several other commercial insurances. And at that point, we'll be able to be in network with the different insurance companies and accept insurance. But for now, we are cash-based and we accept the Medicare, Medicaid, and TRICARE. Stay safe, be well. Until next time, this is Dr. Latoya Wells with Wells Legacy Health and Wellness. Have a good evening. Bye.